Namaste to all of you, and dear friends. Today's topic is acidity, or better, you can say hyperacidity, a condition in which patient has got burning pain in upper part of the body, in upper part of the stomach, in the chest. Lot of patient, they keep medicine with them like ranitidine, omeprazole, Diazine, this type of medicine. They take it and they get relief. And they think it's over. But it's not like that. But I want to tell, hyperacidity is not only having burning sensation here, but it can be in different part of the body, having its effect. We have seen people, those who are using medicine for a longer period, this antacid, their disease can lead to a lot of unexplained diseases like infertility, hair fall, like not feeling well, like a cancer. All diseases can be related to this. So hyperacidity can lead to a lot of chronic and uncurable diseases. So that's why it's very, very important to understand this disease and treat it systematically. Most of the people, they know that if someone is having a hyperacidity, that can lead to gastritis, that can lead to ulcers, that can lead to duodenal ulcer, that can lead to peptic ulcer. That we know. But how it can lead to uncurable diseases like what I said, cancer and infertility, and you just name it. That we have to understand. And I'm going to explain you that today. So most of the time, reason behind hyperacidity is if someone is having more irritant things in his food, like alcohol, pepper, spices. That is one of the reasons. What happened with that irritant food, we are going to stimulate acid production, and that acid production is going to damage our gastric mucus, what works as a protection in our stomach. If that is damaged because of more production of the acid, then more and more acid will come in the stomach because that protective wall is already damaged. And that way, people get ulcers and constant pain in the stomach. And second reason of having this type of problem can be that there is one or other type of infection. Nowadays, that Helicobacter pylori, one can get infected and there can be much more acid production in the body. So if you know the reason, you can always treat that. And third reason is that if our digestion fire is not enough, if our Jatshagni is not enough, that way, if Jatshagni is low, food taken in will be in the stomach for a longer period. And if it's for the longer period, then it's going to ferment. And fermentation, that is nothing else than acid production. And we can call this low gastric motility. That food is there, it's not going further. So if you know the reason, then accordingly we can treat the patient. So in the very first case, if I said that gastric mucus is with irritant type of food is damaged. With irritant type of food, we have stimulated acid production and that has damaged the mucus lining. Then we have to treat that. So we have to avoid that type of irritant food. And we have to give protection of the gastric mucus layer, so that not much acid should be coming out. And in other case, if there is low gastric motility, food is left behind. food is left behind and that food is going to ferment, that ama type of thing is produced. That ama is very sticky, acidic type of food. As we know that food taken in, it has to get converted into our body tissues like plasma, blood, muscles, fats, bones, bone marrow, and sperms. So, with low motility, with low gastric motility, when acid and ama is formed, then that food, what is going to convert into plasma, that is now going to be with this ama, with this acid. So this acidic nutritional food, when it gets into our plasma, then people are going to feel pains in the body. They will be not feeling well. They can have rheumatic pains, unexplained pains. So if that food with ama and acid get into blood, then we have got skin diseases. There can be bleeding, there can be fungus, there can be candidias. So that type of problem one can suffer. And if this food with acid or this ama, if it gets into your muscle dhatu, mans dhatu, then there are chances to get degenerative muscle diseases. Degenerative muscle diseases, that can be tumor, that can be lipome, that can be cyst, and degeneration, that on quality-wise and quantity-wise, your muscle tissues are not being formed. If this acid gets it into our fat cells, then patients are going to have lot of transpiration, perspiration, with foul smell. It's excessive. And now, if this acid, what is being formed because of low gastric motility, gets itself into bones, then patient is going to have pain in the bones. He won't be having that freely movement. And next to bones, we have got bone marrow. And if this acid, ama, can get itself transformed with the food into your bone marrow, in that case, patient can have a lot of nervous problems. He can have problem like memory-related problems. He can have eyesight problems. He needs then glasses to read. And now at last, if this ama acid gets itself into your shukra dhatu, that is your sperms and ovum, semen, then there are problems like infertility, not having quality and quantity-wise semen production, and they can't enjoy their real married life, sexual life. And that way, a lot of problem one suffers because of the acidity. What was not being taken that seriously. So that's why we say that acidity should be treated very, very seriously. Acidity, the main reason is low gastric fire, that is our digestion fire, Jatragni we call. And second is food habits, what I have explained, that if we are just irritating our gastric mucous membrane to produce more and more HCl, and that way, that on its turn is going to damage all that mucous membrane. And one can get problems like ulcers. So how we can treat this, that is more important to understand. So as I said already, that treatment is always of eradication of the reason behind. And reason we have to detect. If it's because of the food habits that there is a hyperacidity, then of course we have to give things like Mukta Pishti. Mukta Pishti is one of the calcium compound, and that is going to neutralize all that excessive acid formed in the stomach. And there are few more herbs like Goduchi, that is Tinospora cardifolia. It's one of the very, very famous herb of Ayurveda to neutralize that pitta in the form of acid. So Goduchi and Mukta Pishti is to neutralize that excessive formation of acid in the body. Then second condition can be that because of the hyperacidity, the mucous membrane of the stomach is damaged. And to heal that, we have got few herbs. Few herbs like Shatavari. Shatavari is Aspergus rasmus. And then second one is Amalki. Amalki is Amblyca officinalis. Amla, we call that. So these two herbs are very, very good to heal that damaged mucous membrane. And one more herb, that is licorice, Yashtimadu. And that's very good to heal that damaged mucous membrane of our stomach. And we have got then one compound that is with all these herbs to neutralize that excessive acid and at the same time to heal that damaged mucous membrane. All in one, we have got one product that is called Agnasid. Agnasid is going to take care of these two factors. And now, if hyperacidity is because of the low gastric motility, then of course we have to increase Jatragni. We have to stimulate your digestion fire. And digestion fire, that food taken in should get burned, should get very fast out of the stomach. So for that, we have got few herbs like ginger, Punarnava, Bhringraj, Eclipta alba. These are the herbs to stimulate your digestion fire. And then carbonative drugs we have to give. Downward movement we have to increase. Therefore, we give soda bicarbonate and the herbs what I have mentioned. These are all in one compound of ours that we call that Mahatarpak. So patient, on one hand, he should take Mahatarpak along with Agnasid. So this is going to be complete treatment for neutralizing that acid, for damage what that has occurred because of hyperacidity of the mucous membrane, and third, to increase the motility. So whatsoever in the stomach is, that should leave the stomach. It should not be left behind, otherwise it's going to ferment and make more and more acid. So besides this all, one should eat at time. One should take fresh food. And food should always be little less than you are used to. So it's in your hands. With education, with information, you can teach yourself. So avoid food what's of irritating nature. And you should eat on time. You should take well-cooked food, fresh food, and little less than it's required. So I hope I have made my point clear. So wishing you all the very best. Next time I will be coming with new chapters. Till then, all the very best.